For today, based on 3,239 new test results over the last 24 hours, the number of confirmed infections has increased by 154 to a total of 4,850. There have also been 5 more deaths, bringing the total to 80 fatalities as a result of the novel coronavirus. And once again, we share condolences with the loved ones and the friends of all of those whose lives have been lost over the past several weeks from the pandemic. I'm pleased to say the number of recovered cases in Alberta has reached 1,800, the majority of whom have recovered at home. We know the virus is not affecting all parts of the province in the same way. There are higher cases in Calgary and South Zone, as we know, compared to Edmonton and the rest of Alberta. And we want to be clear about where we're seeing hotspots and where we are not. In Calgary, we are seeing 3,366 cases compared to Edmonton with 486 cases, and the rest of Alberta at 971 with 27 unknown. Of course, most of those 971 are in the South Zone, and that is primarily because of the recent outbreak involving High River. These regional differences are due to many factors, but it is something that we need to keep in mind as we consider our options for relaunch. Today, 82 Albertans are being treated in hospital for COVID-19, and of those, 21 are in intensive care units. So small increases over the past few days, but still relatively stable. The number of hospitalizations and ICU admissions remain well below the levels that were modeled in the original AHS modeling of 3 weeks ago. So it is encouraging to know that we're still doing a very good job of containing and managing the outbreak. As of today, nearly 132,000 people have been tested for COVID-19, averaging 2,300 per day since the 4th of March, and in the last week, more like 3,300. Before we move to today's update on modeling, I'd like to point out to the wide range of available interactive aggregate data on COVID-19 cases that we have now made available at the alberta.ca website. COVID-19 stats.alberta.ca, that's COVID-19 stats at alberta.ca, was set up to provide daily updates on a variety of statistics using dashboards, graphs, and tables. So if you'd like more information, more detailed information, please visit that website, and it's, I think, better presented than it has been in the past. I'm pleased now to say that our updated COVID-19 data and modeling shows that our efforts to reduce the peak of the virus are working. The number of Albertans hospitalized and admitted to intensive care is well below what modeling originally projected. While this is good news, we must, of course, remain vigilant. The healthcare system continues to be able, very capably, to manage the impact of COVID-19. Albertans are doing their part by following public health orders, practicing physical distancing and good hygiene, and staying home when possible. While we are a ways off from returning to our normal way of life, we are working as a government around the clock on our phased approach to relaunch, which I began, some of the principles of which I began articulating in the television address 3 weeks ago today. Health measures we will be watching include the following: the number of hospitalizations, the number of intensive care admissions, the rate of growth of COVID-19 cases, including confirmed cases as a percentage of testing, and others. Now, the updated modeling uses the most current Alberta data. The updated probable scenario now estimates 596 people will require hospitalization when the virus reaches its peak. This is a reduction from the previous planning scenario, which suggested 818. The new elevated scenario now estimates 745 people will require hospitalization from the virus when it reaches its peak. This is a reduction from the previous planning scenario, which suggested at the time 1,570 cases. We have also created a new low scenario because when we were looking at the actual performance in Alberta versus the probable and elevated models, I challenged our team that's working on the modeling to come up with a model that was closer to what we were actually experiencing here, rather than simply being based on assumptions that we are largely drawing from other jurisdictions. And so that work has been done, and you can see the white line on the bottom of the graph, which is the new low scenario. And again, the predicate there is not assumptions from other jurisdictions or so much as the epidemiological literature as the actual experience that we have seen in Alberta to date. This new projection takes into account Alberta's overall low hospitalization rate, which continues to be encouraging. If trends continue as they are, this new low scenario could become the most likely scenario for Alberta, and let's hope that's the case. This likely new scenario suggests nearly 300 people will require hospitalization when the virus reaches its peak. Why are we seeing lower hospitalization rates in Alberta than elsewhere? Well, we have the youngest population in the country, and we have the best testing program, which means many more Albertans are being tested than other jurisdictions. This high rate of testing means we have a higher proportion of confirmed cases with relatively weak symptoms that do not require acute or critical care in hospital. Additionally, younger populations often do not experience symptoms that are as severe as older people, and therefore are not as likely to require hospitalization. The likely new low scenario is in the updated modeling also reflects this. The new probable and elevated scenarios anticipate that 9% of COVID-19 cases will require hospitalization. This estimate drops to 4.5% under the new likely low scenario. The updated probable scenario now estimates 190 people will require critical care in ICUs when the virus reaches its peak. This is a reduction from the original modeling, which suggested 232. The updated elevated scenario now estimates 248 people will require critical care when the virus reaches its peak. This is a reduction from the original model, which suggested nearly 400. The new low scenario suggests additional 95 people will require critical care when the virus reaches its peak. And the updated probable and elevated scenarios anticipate that 2% of COVID-19 cases will require hospitalization. This estimate drops to 1% under the new low scenario. So overall, you can see that based on the real experience we have seen here, the modelers at AHS, at Alberta Health, are bringing their models down, and we have a new low track, which is much closer to what we've actually been experiencing.